staff and junior clinical staff was not resilient, and we were really struggling to, particularly in the junior medical staff grades, to be able to fill that consistently. Bill?
I mean, I think the issue is that, I don't know when it happened, but it's certainly over a decade ago, Hammersmith was de-designated as an accident and emergency unit, and it was called this so-called emergency unit. The problem with that is you can then no longer recruit emergency medicine doctors or emergency medicine trainees to staff it, because it actually has no substance in a career. So over the past decade, that unit has been staffed essentially by a system that's been cobbled together by people like myself, who are acute medicine consultants, and we're quite good at acute medicine, but we don't know about emergency medicine. So they're two very different fields. And the issue was, we were starting to run that department with no out-of-hours consultant cover and junior doctors that were essentially being recruited from local agencies on the hoof, because no junior doctors were rostered there by the deaneries, and those locums were of mixed quality. And I would regularly spend every Tuesday afternoon trying to cobble together a rota to render the unit safe for the next week, and it was operating hand to mouth. And to be honest, I think it should have closed sooner than it did.
I was asking specifically about the timing of the closure. Did that impact on this scenario?
So has it impacted on the current performance? So the level of activity, patient activity transferring from the Hammersmith in terms of what we planned and what we actually saw was exactly in line. So I think we have got to look at our own kind of arrangements in terms of what we put in place to deal with some of the additional seasonal impact that emerged from October through November, and look to ourselves in terms of making improvements around that. I think, as Bill said, you know, we would have wanted to have closed the Hammersmith A&E, and it's the right thing for us to do. Whether we've been able to manage the consequences of that effectively, I think, you know, you will make a judgment about that, but our performance hasn't been at 95%, so clearly we've not done that as effectively as we needed to. But that's what we've come here and been very honest about in terms of making improvements.